If you are suffering from chronic shoulder dislocation or recurrent shoulder dislocation, then your MRI might show something known as Hill-Sachs lesion. Hill-Sachs lesion means it is a defect in the bone of the shoulder. Basically, what happens when the bone of the shoulder dislocates? This bone is known as the humerus bone. When it dislocates and comes to the front, that is known as the anterior shoulder dislocation, there it develops a dent in the posterolateral corner of the bone. That means the outer and the back part of the bone. So this thing is known as the Hill-Sachs lesion. It is a dent in the bone. Now, because of the recurrent dislocation, it just keeps on coming forward and striking against the bone of the shoulder joint, which is known as the glenoid. So sometimes there is a dent or there is a damage in the glenoid part also, which is known as Bankart lesion. So what happens whenever there is a recurrent Hill-Sachs lesion? Then the patient will complain of pain, instability, difficulty in carrying out daily activities, and this can go on. Also, recurrence can happen again. Sometimes it is painful, but over a period of time it can become even painless. So in such situations, conservative treatment often fails. There might be a need for surgery. In that surgery, through the arthroscopic procedure, depending on the size of the dent in the bone, we are able to manage it by either just making the capsule around that area tight or filling it up with a tendon that crosses the defect nearby. We fill up that tendon and we reef up the capsule, and we can make the shoulder strengthen back to normal life again. Sometimes what happens, the defect is big. So in those cases, we might even require a bone graft to be put. When we put a bone graft to fill up the space, that also helps us in making the shoulder stable again, and the chances of dislocation again are reduced. Thirdly, if the defect is very large, then it might be possible that sometimes even hemiarthroplasty is required. So if you are suffering from recurrent shoulder dislocation, don't worry. Just visit your doctor, he will get your MRI done, and he will tell you whether you have a Hill-Sachs lesion alone or you have a Bankart lesion also, because in Bankart lesion, the glenoid, the bone that stabilizes the humerus bone, sometimes there is a defect in the front and the lower part of that bone also, which is known as the Bankart lesion. So if your MRI is showing there is a Hill-Sachs lesion with Bankart lesion or Hill-Sachs lesion alone, visit your doctor, and depending on how big it is, what are your symptoms, how frequent is the dislocation, he might advise you a surgery to treat it. Thank you.